Hello, my name is Sean Wilburn, and today I'll be talking about the U.S. healthcare system, how it's run, kind of like the breakdown, what America should do to make it more affordable slash free, and my personal experiences with the healthcare system because I have some some opinions about it. So, the U.S. healthcare system, you can tell by number two, is like privately owned, and usually sometimes you can get it paid through from your job. So a lot of certain jobs will cover healthcare. Like one example being like electrical engineerings. Depending on where I go, a lot of electrical engineers get like benefits, which one of them is getting provided full coverage of their healthcare, which is very nice. But some people feel like unfortunate don't have a job but they don't cover it. Some people, as you can tell, pay $599 a month, which on paper is kind of expensive for the human needs because we're dealing with inflation in America. So groceries are expensive, car insurance are going up, gotta pay your phone bill, any like unfortunate like expenses, like maybe you have to repair your car, which can take a toll on your money and how much you're saving and how much you can spend. So the average is $599, which is kind of high for like depending on where you go. It could be different prices from like many different areas. The problem is a lot of people, you can see number one, a lot of people don't have healthcare as studies show in 2023 because it shows like how expensive it is. Since it's privately owned, which means it's private stock, meaning a lot of the stockholders have a lot of power and saying on how much healthcare should be and to make sure that the stocks don't go too down where it's millionaires lose money, which is kind of unfortunate. But I feel that America should, kind of focus really like heavy on healthcare since it's a major problem, and healthcare is like a need for like human society. Like you don't want to be sick and be kind of scared because that's like one of the main problems too. A lot of people are avoiding going to hospitals because bills are like very expensive. Like some people could go to a hospital, they will charge you for ambulance, IV, just being there for a single day, taking up a bed. Like many people voice their frustration because some people will get a $2,000 bill, and if they don't have health insurance, that's $2,000 out of pocket. But another thing too, a lot of Americans pay for healthcare, but your healthcare provider doesn't fully cover it. So they have an opinion like, oh, you need cancer treatment, like you're gonna have to pay that out of pocket. Some healthcare providers will pay some of it, but a lot of times, depending on your medical needs, it all depends on your health provider if they feel like if they should cover it, or they might put you in a wait list to see if you're able to, which is kind of convenient for like the average American, especially you paying so much money on into your healthcare to make sure hoping they cover your expensive, just to be told that we can't give you that money, which kind of fears a lot of Americans going to hospitals and other doctors who don't have healthcare, which can cause many other diseases to spread. Like we see with COVID-19, like a lot of people were panicking, buying stuff, but when they get sick, a lot of hospitals were backed up. But then some people who could went to the hospital chose I don't want to because the bills are going to be expensive, and if it's a false alarm, unfortunately you spend a lot of money and your time realizing it was a simple cold and not COVID, which is kind of like a big problem in America, which can lead to higher death rates, and a lot of people keep spreading diseases get developed, and it's not safe like America. So here are some examples that healthcare systems that other countries uses. So in Canada, as you can tell, they say the single payer system, which is all it's like a fixed cost for all residents, but it's like a single public system. Basically meaning that a lot of people, depending on, doesn't matter about your bracket, your tax, how much money you pay, like everybody kind of pays the exact same amount for healthcare, which is nice, for especially for Canadians. So how much money you're putting into your healthcare, so it helps you. Excuse me, like your bills, Okay, if I have bills here, I know, just say if Canada was $400, like in Canada, you're like, okay, I only have to pay $400 a month, and I don't have to worry about it going increase in prices or decrease unless the government says so. But you can go into your healthcare center, and you know how much something the roughly amount that your healthcare would, you have to pay out of pocket, which is nice. Or you can go with number two, like countries like Germany and Switzerland, who have a multi-payer system that provides healthcare to lower income residents, but also private healthcare, which, in my personal opinion, would be great for America, because you can see like it also ensures that low income and high income residents have the same quality of healthcare, which would be very nice in America, because in America we have classes. So you have the higher class, the middle class, and the lower class. So everybody in those classes would have, be able to get the healthcare they need because it's in their bracket. So like people in the lower class won't be scared, will be more encouraged to go to like the hospital, the doctor, because they know that they're going to charge me in my bracket, which is very nice. It'd be very convenient for Americans, because especially I'm in the middle class, so I'll be kind of like establish a high, middle, and lower income healthcare quality, well, healthcare price, sorry, and I would know, hey, I know I can pay this amount because I'm middle class. It will show in my tax bracket, so I will know what quality will all be the same, but I know how much I'm paying. But you can also go to a private care, which also be from high, low income, or middle classes, which will be more convenient for the U.S., especially since, well, like I said, like all the classes. A lot of Americans will probably be happy if the U.S. can adapt it, because it will encourage more people to actually go seek medical attention and decrease the percentage of people not going, which, if people start going, get vaccines, no diseases will spread, less will be less likely to get caught as well, which will also make, society more safer. You actually want to go outside and, just live life like a lot of Americans want to do. So then we're going to talk about my personal experiences. I have like some medical. My family runs in medical, so I kind of understand. And I had my share of shares with the healthcare system. One of the like number one is my favorite one, where I had to get put out of school, and 'cause I was very sick one of the days, like midway through the day, and I kind of needed to go to like urgent care. So, and my mother has a certain sorry healthcare provider. So not every healthcare provider will take your insurance, which is also another problem in the U.S., because you hope that the insurance you have, you can be able to get coverage, but not all urgent cares and doctors take your insurance, which is also very unfortunate for the American citizen. So instead of, because my doctor, I couldn't just, do step-in checkups, because they only did like appointments only. And I'm booking a same day appointment the same day is kind of difficult if it's midway through the day. So my mother was on the phone with a total of three clinics, and two of them took it 30 minutes to an hour for both a total to speak, because we would get put on hold. And it's like, oh, we give out my information. And it's like, okay, we have to hold. And then just to get told, sorry, your insurance doesn't partner up with us, so we can't. Your insurance doesn't work here. So mother said, okay, that's okay. Thank you. Have a nice day. So to go to the next place, because you don't want to go inside just to get, oh, my son is sick, just to find out, oh yeah, we don't take your insurance. So it took me an hour and 20 minutes to get to an urgent care that takes my insurance, so my mother doesn't have to pay out of pocket for like a checkup to see what's wrong with me, rather than spending like, say, like the bill was like $100, which is very, very inconvenient. Um, One of my bills, for my stitches, I had to get stitches in senior year of high school because I had an incident. So one of my bills was gonna be Gotta go to the hospital to get stitches was gonna be like 1,500. But when I heard about the bill, I kind of got scared for my family because I do care for my family a lot. I know how stingy the healthcare system can be, so I'm hoping my insurance can cover it. Thankfully, the insurance that my mother had was able to fully cover my stitches, my my 6 hour stay at the hospital. So I was very thankful, but a lot of people also doesn't have very unfortunate things with the hospital because sometimes when you go to the hospital, you can't just say, "Oh, do you take my insurance?" Like you go to the hospital, you need treatment now. You don't think about your insurance because you don't want to be in a dire situation. You need like medical attention now, just to get told, "Oh, you don't have insurance." You have to go like say 20 minutes to another hospital. You really don't want to do that, so you just hope that it takes your coverage. Now, number three, I haven't gotten yet, but I've gone to many my dentist appointments. I have to get braces in the future. When I was at one of my meetings, braces is very expensive in the U.S., which is kind of very unfortunate. When I was with my parents, we talked about getting braces for me because I need braces. We gave them my insurance card, insurance information to see if my healthcare provider will cover any expenses because we knew that the healthcare system would not push to spend money on braces, like the full coverage, which I hope, but we live in America. So what happened was they came back to us and they were like, well, we see sometimes like the people who have your insurance, there is a chance there will be a coverage for a fixed amount, but you're not guaranteed that coverage. When we heard about it, we thought like, oh, that's very unfortunate because if if my brace is gonna be very expensive, then my family has to save up to be able to pay the amount that needs to be paid, while my health insurance can also pay their share amount whatever they want to pay. But for the most part, I feel like the healthcare system in America is not the very best. I really wish the government could work on making it better for American citizens because it is like a human necessity. You need healthcare. Your health is very important in America, and a lot of people try to voice their opinion that you people need to take care of the health, take care of your health to make a better society. But as of what all the politics going on, healthcare among the both political parties, because I personally like politics. I like you know talking about it, well, hearing about it, but talking about it is a little. Sometimes it depends what we're talking about. But healthcare is a very major topic in the government conversations, and both parties can't find a common ground about it. Which hope eventually they can find a common ground to make it more cheap, because you got people paying cancer treatment, and everybody knows that the cancer treatment doesn't kill the cancer; it limits the spread. But I don't like it when people are going through cancer treatment because my grandmother went through cancer treatment. R.I.P. to her soul. But I don't like it when I hear that you have to pay like a very expensive amount for cancer treatment, and say if you don't make it hurts their family, and it kind of hurts like the family's bank account if they're trying their best to keep their loved ones alive, and it's very not convenient for the American citizen, which is very unfortunate. But that's all I really have. Hopefully, the younger generations like us would fix the healthcare system, make it better for American citizens, like other countries did for their citizens, and also encourage people to seek medical attention and not be scared of a piece of paper that has money on it.